Hemorrhagic stroke can be devastating. But what happens to the brain in a hemorrhagic stroke? And what can you do perhaps to make it safer for your patients when you diagnose issues and you treat them? Hi, I'm Dr. Brian McDonough, and welcome to Primary Care today on ReachMD. My guest today is Dr. Annalisa Scimemi. She's at the University of Albany. She's a biophysicist, and she and her team of researchers are studying the receptors in the brain that may contribute to brain damage immediately after hemorrhagic stroke. First of all, welcome to the program.
Thank you. Thanks for having me.
Let's talk just in general about, for our physician audience and for other healthcare providers, what happens in a hemorrhagic stroke, if you could just break it down and explain.
Yeah, in general, we define a hemorrhagic stroke as an event caused by the rupture of a blood vessel. So somehow you have blood where you wouldn't like it to be, and the tissue around the blood vessels in the brain is important because it's what allows us to form memories and just be who we are in our daily lives.
So when that happens, what are the risk factors for it?
Well, there's a number of risk factors from a clinical standpoint. One of the most obvious is high blood pressure, hypertension, and so on and so forth. But we like to study stroke probably at more of a molecular level as opposed to a clinical level. And that's exactly what we did in our work.
When you examine it at the molecular level, what are some of the things you see?
Well, some of the things that we see are changes in the anatomy of the brain. And it's impressive because these changes take place in a short amount of time. Well, a change for us is a change at the scale of a nanometer. And just to give you a little bit of a sense of how much that would be is 1,000th of a micron, or if you want, 1/1,000,000th of a millimeter. So tiny, tiny changes, but they carry a lot of weight when it comes to the function of the brain.
And when these things happen, how do you measure the changes and where the damage occurs, why, and what it leads to?
So we are electrophysiologists, so we measure these by performing recordings of the electrical activity of cells within the brain. And what we find is that these changes impair the efficacy of synaptic transmission. In other words, neurons in the brain communicate by releasing chemicals. And after stroke, the communication doesn't happen anymore. It's as if someone was trying to make a phone call, but there wasn't anyone else at the other end of the line to pick up the phone call.
Is it a scarring that occurs, like with the heart, or is it just that it just doesn't have a way to get from one cell to another?
It's a restructuring, so I wouldn't call it a scar from what we have seen, but it's like rearranging the cards on a table. Things change, and these processes of cells are in new places where they didn't used to be.
Trying to take this to a real-world level for clinicians,
yeah.
When someone suffers a stroke and they start to show improvement over time, either with rehab or a week or two later, things get better, what's happening in those situations with the cells?
Probably there are forms of plasticity. In other words, the brain realizes that something isn't as it used to be and tries to reorganize everything to restore the function as well as it can. I think depending on the damage, the effort can be more or less rewarding.
How long has this science been going on? Has this been like a couple years, 10 years, 20 years? When did we start to understand these things and look at it at the level you are?
So in general, I think worldwide it's an ongoing effort. In my particular case, I would say it's probably now 4 years because 4 years ago I started my own lab. And so that's when probably these research efforts started really making a difference, I would say.
This is Dr. Brian McDonough. You're listening to Primary Care today on ReachMD. Our guest is Dr. Annalisa Scimemi. She is at the University of Albany, and she's a biophysicist. And she and her team of researchers are looking at receptors in the brain and looking at how brain damage may occur after hemorrhagic stroke. And it's interesting when you talk about the brain, we take it for granted for obvious reasons, but there's so much going on there. Just to have just a normal thought and to move your arm, all those things are literally so complicated. By studying at the level you do, does it really reinforce that? Are you impressed, or do you now start to take it for granted?
No, I'm always amazed because, yes, there's so much that needs to happen at the right place and the right time to make us do, again, everyday activities. So it's amazing at how perfectly everything works. So I share that feeling.
What are some of the things we should do to have a healthy brain? You see it at the microscopic level, literally. What should we be doing in our life to keep those cells working the way they should and kind of staying in the best condition they could be?
I think one suggestion that I would give is use it to the best of your abilities. And when I say use it, it's probably challenge it. Don't do things routinely. Try to be creative in your daily lives. It would definitely allow your brain to be much more plastic.
Are there things we do that damage the plasticity? Drinking or eating poorly, are there things that really impact it?
There are definitely risk factors, and so these are probably the ones that we hear about a lot of times. So definitely drinking, smoking, and so on and so forth, and lack of exercise. Those in the long run are things that affect every single piece of our bodies, including the brain.
Things that specifically attack the brain, what would you say?
I wouldn't say that some of these habits attack specifically the brain. I like to think of the brain as a part of a much more complex machine.
When you talk about dementia, and I mean, I'm not going to go too far afield, but when you talk about dementia, we talk about Alzheimer's, we talk about also multi-infarct dementia, those things. When you examine and study the brain in those situations, or you've read studies about it, are we any closer to finding out what's going on than we were maybe 5 years ago?
Definitely, I think over those type of time scales, progress is being made. But unfortunately, we haven't really reached the target. So there's still the need to dedicate ourselves to those studies.
Dr. Annalisa Scimemi is our guest, and we're talking about the brain. She's doing work with hemorrhagic stroke and brain damage. From what you're doing in the 4 years and the research, what are some of the things that you're learning that may impact care, or even with that understanding, ways to change the way we're treating people after a hemorrhagic stroke?
I think is that we can approach these diseases from different angles. So, for example, our work doesn't allow us to prevent strokes, but it allows us to deal with the aftermath, so with the cognitive impairment that can be caused by a hemorrhagic stroke. So I think that's what we learn, that we should probably put ourselves in different positions and try to attack the disease from different perspectives.
So the big thing is obviously control your blood pressure, make sure you stay in its best condition as you can to avoid that situation in the first place, I guess, is the big issue.
Yeah, definitely.
What about the theory that you begin your treatment as quick as you can for rehab? Is that something that still holds water, that we should get people moving as fast as we can?
In general, but I would probably say that I'm the basic scientist, and so probably a clinical person
Sure.
would have much more insights into that.
But what you're saying more is you can see the damage, at the cellular level. I understand.
Yeah.
What other things are we, let's say, in the next few years looking at that we may not know now, or things that you're trying to find out any down the road that you find maybe exciting about the brain and the cellular makeup?
Yeah, I think in general, we should probably be, on the way of visualizing things in the brain, probably with more accuracy, spatial and temporal accuracy. And I think that will bring some exciting news. And our goal is always to, improve early diagnosis. I hope that will, again, make us feel in a much better position a few years from now.
Dr. Scimemi, I'm afraid we're starting to run out of time. I wanted to ask you, though, one other question. Is there anything that we didn't talk about that you thought was important to bring up in this conversation? Because we've covered a lot of ground in a short period of time, but is there anything that you wanted to add?
Probably step a little bit away from the clinical side, but I would share with you how important it is just to study the brain and how fascinating it is and challenging. So I would encourage everybody just to keep their interest awake.
Would you say it's one of the last frontiers in the body? I've heard people say that, we understand much less about the brain than perhaps other organs. Do you think that's true, or do you think we're catching up fast?
I think we have definitely done a significant improvement over the last few years, but there's a lot to be known, and I feel that we are just really at the surface of something that can bring up new discoveries.
Dr. Annalisa Scimemi, I want to thank you for joining us on Primary Care today on ReachMD. I really appreciate your taking the time and continue doing the great work.
Thank you so much for having me.
This is Dr. Brian McDonough. If you missed any of this discussion, please visit ReachMD.com/primary care today. You can download the podcast. You can learn more about the series. Thank you for listening and being a part of the knowledge.